Dr. Patel, today is a day I really want to address something that's running rampant in society, which is diabetes.
Yes.
Diabetics suffer from leg cramps, restless leg syndrome, um, and a lot of folks are being misdiagnosed. Uh,
Hmm.
so, what are your thoughts on this? Diabetics, leg cramps, restless leg syndrome. What's causing it?
Yes. So diabetes is become very prevalent in this country and, a lot of the other major countries. If we think back and look back in the 1980s, diabetes wasn't so prevalent. Um, it became more prevalent by introducing corn syrup into the diet. There are some studies, that shows that, such as in the sodas and food and things like that.
Right.
You know. And as we know, in the 80s, life became very fast for a lot of people on the run and eating out, fast foods and, the big jug of Cokes and things like that were very common. And I think we're seeing the health effects of that type of or those habits, um, because any disease takes a while to come into play and affect your body. So if you look at peripheral artery disease and diabetes combination, um, diabetes didn't cause much of PAD in the 80s.
Mm,
But over the last 15 to 20 years, it's become a major causing factor for peripheral artery disease.
mm.
Prior to the 80s, it was smoking, the Marlboro Man, you know,
Yes. Yes.
yes, yeah. So smoking was the number one cause of peripheral artery disease, and now diabetes is, leading the way for peripheral artery disease. You may ask, what is peripheral artery
I was
disease?
just about to ask that question. Yes.
So, peripheral artery disease is disease involving the arteries of the legs, for example. Um, what it is the buildup of plaque
Mm,
uh, in the arteries. Arteries are like a hollow lumen, and when you have buildup of plaque inside that lumen, it causes narrowing of that lumen. And when you have narrowing of that lumen, that means there's less blood going into your legs. Okay. And when there's less blood going into the leg, that's when you get all these symptoms, such as when you're sitting at home doing no activity, you may be fine because there is not much of blood flow required for your muscles because they're at rest. When you start walking,
mm.
now the muscles need more oxygen, more nutrition, more blood. And it's not getting it because of the blockages or narrowing in the arteries.
Right.
And when you don't get the blood flow, that's where you get the cramps. Okay. It's like going to the gym and overworking out your muscles and you get that cramp because you're working out faster than your body can provide you with blood flow to that muscle. So
Right.
same thing happens when you're walking and you have blockages in your circulation, you get cramps.
Right.
Okay. So this is called claudication. When you walk, you get cramps in your legs, and then you stop for 5 to 10 minutes. Those cramps go away, and then you walk again, and you start getting cramps again. Okay, that's called claudication. And this was the typical presentation of patients who used to smoke or high blood pressure, hypertension. But diabetes presents in a different way. It affects peripheral artery disease in a different way, in the sense that patients may not have cramps when they walk because it affects the smaller blood vessels. It starts in the toes and then comes up your leg. Most of the blockages in diabetes compared to smokers, it starts higher up and then comes down. So when it affects these smaller blood vessels, you tend to get numbness and tingling first in your toes.
Right.
These most of these patients with diabetes, they have numbness, tingling, or they have neuropathy. And this is all before we thought neuropathy was from diabetes affecting the nerves. But now we know that neuropathy is because of the blockage in the circulation to the nerves. So if you were able to open up this circulation, their neuropathy improves And some of these patients, neuropathy goes away altogether. So diabetes is very complex disease, and it affects many parts of our body. You know, it affects the eyes, so that's why we get, you know, eye exams when you're diabetic. It affects your kidneys, it affects your feet. You know, that's why we go to the podiatrist, you know, every month or every 2-3 months to get your feet checked, because it's important to catch the progression of this disease, you know, before it gets worse.
You know, this is interesting. You say arteries, and
Mhm.
most of us know arteries associated with the heart. So this is arteries in your toes and your legs. Talk to me about how it works with what you do in treating, you know, the minutes of arteries in your toes.
Right. So a lot of patients, we have, when they have diabetes causing peripheral artery disease, it could be in their initial stages, such as, you know, numbness, tingling, or neuropathy. Uh, then it can lead to cramping in their toes, especially at nighttime when they're sleeping, because these diabetes affects the smaller blood vessels in your feet and your toes, and below the knee vessels as well. So most of the time, when you're sitting and standing during the day, the gravity kind of helps bring the blood down, you know, to your legs and your feet and all that. So you don't have those symptoms. But when you're sleeping at nighttime, when you're horizontal, your heart has to now push the blood all the way from your heart down to your toes at an equal level. And when you have blockages, it doesn't get there. So these patients typically will get cramps or numbness and tingling. It'll start out with numbness and tingling in their toes, in their forefoot. Then it leads to cramp because you're not getting the blood flow. And then some of these patients will, you know, hang their feet off the bed, you know, to feel better because now the gravity brings the blood down, you know, or some of them will have to get up and walk around a little bit, you know, to relieve those cramps, you know. Excuse me. So it affects in a different way compared to claudications from smoking, where they get cramps when they're walking. In diabetes, they get cramps when they're sleeping at rest. So that's why it's called ischemic rest pain. So they get pain at, you know, when they're sleeping. Now, some of these patients, the disease has progressed so far that sometimes they have an open wound in their toes or in their feet. You know, it just opens up one day, and, you know, because you're not getting the enough blood flow to your skin, and the skin breaks down and leads to an ulcer. Or they bump their toe onto something in the house. They're walking, and, you know, obviously they don't have the sensation because of the neuropathy. They don't know they bumped their toe somewhere, and that leads to an open sore. Or they're wearing tight shoes, you know, that rubs against their skin, and that also splits the skin and gets an open sore. So once they have this open sore, and if you're a diabetic, you know, if it doesn't heal in 2 weeks, then you should go and get your circulation evaluated. Because
Right,
in a normal, healthy person, the wound should heal within 2 weeks.
right,
You know, a lot of these patients are fighting day in, day out. You know, they just have this chronic wound. They keep going to wound care clinics, you know, and it just, if you don't have your circulation evaluated, then it's just like putting a band-aid on something just to cover it up.
right.
So it's
So
very important to get the circulation evaluated for these
yeah, I
patients.
mean, there's a lot of issues with diabetics and wounds and now leg cramps, and we're talking about leg cramps today. But how does one know that they qualify for PAD, peripheral artery disease treatment with yourself?
Sure. I mean, just the risk factor alone, if you have diabetes and you're above the age of 50, you know, it's important to get screening done for your circulation. You know, age and diabetes go hand in hand for peripheral artery disease. Same thing, if you're a smoker and you're above 50, it's, you know, highly recommended that you get screened for peripheral artery disease. And it's also recommended by the American Heart Association and American Diabetic Association that patients who are above 50 with the risk factor of diabetes or smoking, they should get screening done for peripheral artery disease. So now what is screening, right? What is screening for peripheral artery disease? It's not an invasive test. You just come in, I do a physical exam of your pulses, you know, feel for your pulses in your feet. We have a little Doppler. We can, check with the Doppler, see if we can hear your pulses. It's a very simple, non-invasive technique to evaluate if you have peripheral artery disease. It takes half an hour, and
Right,
at least you can be at rest saying, okay, I'm not at a stage where I need something done for my PAD.
right, right. How do patients get in touch with you, Dr. Patel?
So we have created a very easy phone number to contact us.
Mhm.
It's 1-833 leg cramp, LEGCRAMP, 1-833 leg cramp, or you can visit our website, www.avavascular.com. That's avavascular, one word.com. We're
So
located
I
in,
actually, sorry
sorry.
to interrupt you, but I went on your website
Mhm.
and I saw a mechanism to actually answer some questions for PAD risk assessment. It's all on there. Is this something you encourage folks to be
Yes, I
doing?
mean, yeah, a lot of people don't have time to come to the doctor's office, so we have developed a screening tool on our website. It's a simple questions. You answer these questions, and it tells you what percentage are you at risk for having PAD.
Right,
Okay. And once you fill that out, we also get a copy in our office, and then I can call you with the number or email provided, and we can discuss further whether you need any, treatment option, or you're perfectly fine where you are and you don't require any treatment. So it's a very easy screening tool. It takes barely 5 minutes to fill this questionnaire out. It's on our website. And at least you can sleep at night saying, okay, I don't have PAD once you fill this out,
right,
or if you have it, then you can come into the office. We can discuss what are the options for you. Sometimes majority of these patients just need medical management or an exercise program, to improve their symptoms.
I have one last question. The healthcare system bounces you around different specialists. Now, I'm assuming you take Medicare, PPO, and insurances that allow patients to come direct to you as opposed to getting a referral from their PCP, their primary care physician. Um, but when they get to you, is there a big long wait because people are in pain? They just want their lives back. And the PAD candidates that I speak to, they tend to get the runaround, whether it's take this pill, this painkiller, maybe a diuretic because they think they have water retention or whatever it is, and they're not getting better. In fact, they're getting worse. So what's your approach to time and getting to the root cause of problems?
Yes. So somebody who has a wound, obviously we would see them within a day or 2 days maximum. Somebody who does not have a wound, just symptoms, we can get you in within a week's time to our office. Like I said, if you just fill out that screening form, it
Yeah,
tells me where you are in your disease. So if you're with a wound, we can call you right away.
right,
Uh, and there is treatment options available. There is a lot of patients feel that they have neuropathy or numbness and tingling in their feet, and they're supposed to feel that way because it's just part of aging. But it's not true. We have a lot of
right,
patients who have benefited from this procedure. They have changed their lifestyles. We had patients who come in with a walker because they're not able to walk, and once we open up that circulation, now the muscles getting all the blood flow. They're getting more stamina, they're more strength in their legs, they're able to stand, they're not having these frequent falls because of the weakness in their legs. And a lot of patients have also gone away without a walker now. They can walk without a walker because you have more blood flow coming into your leg by opening up these blockages.
right, right. Well, that's pretty awesome, to be honest, because my family is we have a number of people in my family with diabetes. Thank God I've just stayed away from it so far. But I know that leg cramps, restless leg syndrome, just a continuous misdiagnosis has been an issue, because doctors are not aware, I guess, with what you can do with peripheral artery disease intervention with interventional radiology.
Yes, there's a lot of misconception. and misunderstanding about how diabetes affects the blood vessels.
Yeah.
And that's why there is delay in patients' treatment. I mean, we have had patients with neuropathy on, gabapentin, which is a common medication that they put on, and they're on it for life, for several years.
Right.
They come to us and we evaluate their circulation. We open up their circulation, and now their neuropathy is gone. They don't need to be on the gabapentin anymore.
Mhm.
But not only that, but it improves their, a lot of these chronic disease, it also affects the mood of the patient, causes some sort of depression also,
Yes, it
long-term
sure
depression.
does. Mm-hmm.
So when we open up, we had a patient, we open up the circulation, um, neuropathy went away. So now when the neuropathy goes away, now they're able to actually feel the floor when they stand, when they feel the floor. Before they couldn't feel the floor, now they can feel the floor. So now what happens? Their balance improves.
Yes.
Okay. They're more confident in taking steps. So now they're
Right.
walking better.
Yes.
When you walk better, you have less falls. And also when you're doing more walking, your overall health improves, your mood improves. So there's a lot of benefit in just opening up this circulation. Simple thing like restless leg syndrome. A lot of people, it's a term which nobody really knows what it's from. But patients with PAD also have restless leg syndrome. And why does that happen? Because when you're not getting the circulation in your leg, what do you do? For example, sometimes you sleep at night and you wake up and your arm is like numb, right? So what do?
Yes.
You take that hand and keep moving around to get the circulation back in.
Yes.
So when you have restless leg syndrome, what are you doing? You're trying to improve circulation by keep moving your leg, you know,
Right.
because there is a problem in your circulation. There are other causes of restless leg syndrome, but PAD can cause restless leg syndrome as well.
Got it.
You're trying to improve that circulation by moving your legs around, unconsciously. So there's still a lot of people don't understand, how diabetes, specifically peripheral artery disease and diabetes can present. It can present in many ways, just numbness, tingling. It can be cramps. It can be a wound or ulcer that's not healing. It could be with frequent falls because you have less strength in your legs. It could be just balance issues.
Right. Right.
So
I love that. I love the fact that you're giving confidence back into folks that have been in constant pain. I'm not talking about months. Some of them are years.
yes,
Yeah.
they've
Yeah.
been misdiagnosed. They're like,
Right.
they've been told, hey, this is a medication you take. There's nothing else we can do.
Right. Right.
That's wrong. We understand the disease better today than 10 years ago, and
Sure.
therefore we have better treatment options,
Well,
than
thank you
just
so
simply
much, Doc.
giving a pill. Than simply just giving a pill to the patients.
Yeah. No, I'm excited for patients who need this care, because some of them are really the word that you used today that really hit me hard is depression. And I think, if you're giving someone hope that they'll
Mhm.
be able to live their life, even if they're 65 plus, to give them hope of actually getting back into the rhythm of life.
Yes.
Enjoy their grandkids, go to the supermarket, go for a walk, play golf. All of that's just a new lease on life. So I appreciate you speaking to me today about diabetes and PAD, peripheral artery disease. And I believe it's 1833 leg cramp.
Correct. That's correct. 1833 leg cramp.
And they can call you or take a risk assessment on your website, which is www.avavascular.com.
Correct. Yes. Any of those options is fine. The risk assessment tool is just for the patient so they can see themselves where they are with the disease process. But if you're someone who wants to talk to me, feel free to call our office and I'll get on the phone and talk to you.
Very exciting. Thank you, Dr. Patel.
Thank
Thank
you,
you.
Hema. Have a great day.
Bye-bye.
Bye-bye.